Attention to health. Non-communicable diseases account for about 29% of all deaths annually in Nigeria, representing approximately 447,800 deaths each year. The leading causes include cardiovascular diseases, cancers, diabetes, chronic respiratory diseases, and mental health disorders. Premature deaths from non-communicable diseases, especially between the ages of 30 and 70, highlight the urgency for interventions. Well, the burden of NCDs in Nigeria has been increasing due to risk factors such as unhealthy diets, physical inactivity, tobacco use, and harmful alcohol consumption. Environmental and genetic factors also contribute to this rise. For example, Nigerians are reported to consume high levels of sugar and salt, significantly exceeding global averages. Despite these challenges, family health physicians say most risk factors for non-communicable diseases are preventable. Well, let's bring in our guest on this conversation, a doctor. She is Dr. Ngozi, and she is in charge of family health practitioners in the Federal Capital Territory, Abuja, I suppose. Thank you so much for being on the news tonight.
Yeah, thank you for having me.
Great. So you're in charge of family health physicians, am I right about that?
No. Family, I'm the first female chairman of the Society of Family Physicians of Nigeria.
I like that.
Yeah.
First female.
Yeah.
Congratulations.
Thank
Well
you very
done.
much. Yeah.
So this is a serious issue. I mean, 29% of all deaths, non-communicable diseases. Can you explain to our viewers, first and foremost, what are non-communicable diseases? I know I've reeled out some, but what do they mean when you say you have a non-communicable disease?
Okay, thank you for that. Non-communicable diseases are those diseases that are, like the name says, non-communicable, meaning that they can be transmitted from person to person. So they run a chronic course and they have long-term health consequences. Top on the list are diseases like the cardiovascular diseases, hypertension, like you mentioned, heart attacks, strokes, and then you also have the chronic pulmonary airway diseases, and then the cancers, which are killers. So these diseases are causing a menace. Like you rightly said, about 30% of the deaths in Nigeria are caused by non-communicable diseases, but globally, it accounts for over 70% of the diseases, and the ages affected are really between the ages of 30 to 70 years. And it's estimated that by the year 2030, these diseases would actually cause over 51 million deaths. And that is why organizations like the WHO and the World Bank are really worried, and is a burning item on the global health agenda.
So this is preventable?
Very preventable, yeah.
And they do say prevention is better and cheaper than cure.
Exactly.
So how do we prevent this?
Okay, we'll talk about the risk factors. There are some risk factors that are associated with the development of non-communicable diseases. So the ones that are actually preventable are the actually two types, the modifiable and the non-modifiable. So by the modifiable, we mean those ones that you have control over. Then the non-modifiable are those ones you don't really have control over. So when we talk about prevention, we're talking about prevention of the modifiable risk factors. For instance, tobacco consumption, that's very bad. So people should actually stay away from tobacco. Things like inactivity, sedentary lifestyle, those are the risk factors that can be modified. And then being overweight, you know,
diabetes.
So diabetes. Being overweight is different from diabetes. Yes. So when you're overweight, you have to work on your weight by regular exercising, cutting down on food, and there are also certain foods that you should eat to make sure that you have a healthy, lifestyle. So those are the things that you can do, and that's where the family share comes into play. You know, when we have our patients with a health talk like we are doing now, advocacy to the government to improve the policies on health. And then we can also, when they come to the hospital, we manage them. And then we also offer rehabilitative service. We also coordinate their care. So we refer them to other specialists. For instance, if you have the complications of high blood pressure, we refer you to a cardiologist, to a nephrologist, as the case may be.
Great. Yeah. I mean, imagine my shock when I hear that Nigerians consume a lot of salt and sugar above the global average.
Yeah.
How serious is that?
Wow, yeah, it's quite serious because we consume a lot of salt. I remember when I was a child, my dad, for instance, used to use a lot of salt. So when my mom prepares food, he will actually
An additional
one. Yeah, you want
taste
exactly taste the food. So that's a habit you see across households in Nigeria. People always have table salt on their, dining exactly to add to food, and that's very bad because salt absorbs water. So, and that's like when I want to explain it so that everybody understands that.
Yeah.
So it attracts water to it. So that causes like a fluid overload. So you can imagine a tank that is so full, and then you need to pump water across the household. So you need an increased pressure to do that. So that's just what it's all about. So when we consume a lot of salt, we predispose ourselves to high blood pressure. And then, of course, the sugary things we're talking about, not necessarily for the high blood pressure, for the diabetes. Because one thing you should also understand is that as the body is aging, there's a decline in the function of the body. And that's why these diseases manifest towards, the third, the fourth, and the sixth decades. It's like an engine, a car, a brand new car that you buy, and you don't take it to the mechanic for servicing. It will definitely crash. It will definitely break down. Exactly. So, yeah, so that's why you need to come to the hospital for your
checks. I'll come to the role of the hospital and the physicians very quickly, but I wanted to ask you, we've seen groups clamoring and doctors clamoring for government to increase the tax on sugar to discourage consumption of those drinks. Do you think that's enough?
Well,
would that work?
Yeah, that's part of actually what government should be doing to mitigate this menace of the non-communicable diseases. In addition to all of that, there should be advocacy, there should be capacity building. Healthcare workers should be trained on, how to treat NCDs. Government should invest in infrastructure to build like walkways, recreational parks where people can, go out and have their exercises. Of course, legislation on tobacco, on alcohol is also part of what government should, and increased funding for health. Yeah.
Sometimes I make a joke to say that as a Nigerian and living in Nigeria, every day is an exercise for you, from mental to physical. But, don't take me seriously. Let's go to the prevention and the role of physicians in all of this, because there are issues of early detection playing a role, misdiagnosis. How much, does this contribute to the numbers we are seeing, the terrible numbers we are seeing in Nigeria when it comes to misdiagnosis and late detection?
Okay, like you rightly said during the intro, that prevention is cheaper and better than cure. And that's exactly what happens in non-communicable diseases. When you hear that people survive cancers, it's actually because they were detected early, and then interventions were also, started early enough. So the bane for the reduction of non-communicable diseases in the whole world is early detection. So people must come to the hospital. We as family physicians are trying to remove this mindset. Nigerians, they have this apathy for hospitals. When they hear that people come to the hospital, they're like, wow, is it that serious? So we're trying to see if we can encourage people to come not only when they are sick, but also when they are healthy for their health checks. Because if there is early detection and prompt management of the cases, it will drastically reduce the numbers that we are seeing. So
great, fantastic point you make. But on the flip side is misdiagnosis. There are people who go to the hospital and these diseases are missed until they get to the late stages. We have seen numerous cases in Nigeria.
Okay, I don't want to stand in for...
But do the doctors take some blame in that? Or is it the health sector in Nigeria that takes the blame for that?
That's why I actually said earlier that part of our mandate as the Society of Family Physicians of Nigeria is to ensure that family physicians take over the primary healthcare systems in the country, because we are trained to detect these illnesses. Yeah, there may be misdiagnosis, especially when the doctors are not, well trained to detect them, especially the cancers. But that's why we also said that government has a role to play in capacity building. They just keep to continue training of the healthcare workers. But I bet you that diabetes and hypertension would not be missed by any doctor, no matter where the doctor is practicing. These are practical things. Yeah, because,
All right, so finally, before I let you go, I was going to talk about when you say people are so scared to go to the hospital. Is that as a factor of the money they have to pay, the expenses? Because we know that the health insurance coverage in Nigeria is still abysmal and people pay out of pocket for health. That can be scary to anybody who is facing inflation at this time. And you're telling them to come to the hospital to check regularly. So how do we balance that?
Okay, it's actually multifactorial. I agree that the cost of healthcare is quite alarming, and that's why we talk about universal health coverage, and that's why we want to ensure that there's equitable health, and that's why you also rightly said that the capitation for the National Health Insurance Act now is very abysmal. So, but we still encourage people. It's cheaper to come to the hospitals to get yourself tested and then get yourself treated. You know, then government should. That's why we talk about funding. Government should actually increase the
funding for the health sector.
Yes.
Thank you so much, Dr. Ngozi Mmamelu.
Yes.
Did I get that right?
Yeah,
for being
right.
on the news. We do appreciate your time.
Very much.
Thank you so much.